Good afternoon and welcome to our webinar. My name is Tammy Weber. I'm the managing attorney of Marshall, Parker, and Weber, and we're happy to be here today with you. If you don't know already, we have 3 certified elder law attorneys at the firm, and we can help you with all ages with your estate planning, special needs planning, estate administration, and trust planning. We also enjoy working with different agencies, organizations, and professionals, and that helps us give you, our clients, or you professionals, the best information. Today, we're fortunate to have Melissa Bottorf, who is the lead link coordinator here in our area, our Section 8, I guess, right, Melissa?
That's right, Service Area 8.
Service Area 8. The Pennsylvania Department of Aging has this program called PA Link, and it helps with aging and disability resources. So, Melissa, you're going to educate us a bit today.
I will do my very best. First of all, thank you so much for being here. I'm happy to be in the office and have the opportunity to talk to everybody a little bit about what PA Link is. Sometimes it's a little confusing, I think, and it's nice to have a way to clarify some things because it's really a great program. Now, so what is PA Link? So if you look at the screen, you can see that PA Link is a cross-age, cross-system network of partner agencies collaborating to serve individuals who need long-term care supports and services. Well, that's great, and that's what our mission says, but what does that really mean? It's kind of confusing. If you read it and you look at all those words, it's kind of difficult to figure out. Really what PA Link is part of a federal initiative called the No Wrong Door approach. And a lot of times when I go out and I speak with people and I'll say, has anyone ever heard of No Wrong Door? And no one raises their hand. And it's okay.
Because they don't want to make a wrong statement.
Well, that's true, yes. And I think of some people, it's kind of an industry term as well.
Yes.
You know, we working in this industry have certainly heard what No Wrong Door, but other people have not. And that's okay, but we're just working to fix that problem. And really what that means is that if an individual that's a senior or maybe with a disability were to call you up, Tammy, or be in the hospital and be talking to a discharge planner or something along those lines, if they ask for help, even if that individual themselves can't tell them what to do, the No Wrong Door idea is that they're going to be able to point them in the right direction and hopefully point them to somebody that really is going to know what to do and how to help them. So that's really the approach. We do work with seniors and individuals with disabilities. Those are our 2 focus areas that we have. And the job is really, I do credit the government for trying to make something streamlined. And we're trying to make this a streamlined process. And I know when we go out and we talk with people, the process isn't easy. It's hard to navigate. There's lots of things out there to consider, and people really don't know where to start. So if we can help what we call the point of entry and getting into the system, and if we can streamline that process, that really can go a long way to enabling these individuals, who really are our most vulnerable individuals, get the long-term support and services they need. And that's going to make them safer and more independent in their homes.
So that long-term support and service is really what one of the many acronyms, LTSS, that we see around stands for.
Absolutely, yes.
Okay.
Yep, a lot of times you'll see that LTSS. And speaking of acronyms, Tammy, below on the screen you'll also see it's called the Aging and Disability Resource Center, ADRC. So you may have heard of that acronym floating around out there. In Pennsylvania, we have a tendency, we like to change the name on everything. So the ADRC is actually the federal initiative, and if you have a relative in another state, they may know Link more as the ADRC, or the Aging and Disability Resource Center. Here in Pennsylvania, we call ourselves PA Link. So,
I didn't say at the beginning, Melissa, and I think this applies to your program as well. Laws change, funding changes,
Absolutely.
Regulations change. So everything that we're talking about today, August of 2017, applies now. We can't promise what the rules are going to be in the future.
Absolutely. None of us are able to see the future, so we certainly don't know what's going to happen tomorrow. But as of today, this is how things are working, so absolutely. And then the PA Link program, too, has really kind of undergone a little bit of a transition the last couple of years. I've only been with the program now, actually not even 2 years. But when this program was introduced, it was really about the bricks and mortar idea of an aging and disability resource center. And what that means is that, a senior or somebody that is having trouble with navigating this system would get in their car or get on the subway and go to an actual building where they would talk to people and they would be able to pick up resources and figure all that stuff out. And that's great in theory, and it's a really great way to get things to happen in places like Pittsburgh or Philadelphia. But as many of you know, and as you know with the car and the mileage,
Right.
we're in central Pennsylvania. This is an area that's very rural, as is most of Pennsylvania. So it really wasn't getting those most vulnerable people who really need it. They're not the people that are able to drive to a physical location. So as the program has progressed, we've changed. We've regionalized a little bit more, and we've really moved in a direction where we try to localize the troops and impact the troops locally, so to speak, those professionals, and kind of go out to the seniors and individuals with disabilities. So a couple ways that we can help. Oftentimes with PA Link, we have a couple of buzzwords. At least they're not acronyms, but they're certainly buzzwords. And one of those is unmet needs. I talk a lot about unmet needs. And that's really one of my big goals when I am looking at programs and when we're working together. I work with an oversight committee to determine what we're going to do throughout the year. Those unmet needs are what really come up to us a lot. And collaboration. I'll also use that word a lot today too. That's my disclaimer on this collaboration.
Important. Okay. Important.
It is.
It's team effort.
It is. That's one of my other buzzwords is collaboration. But one of the big ways that we do this is we do what we call partnership development. And that's networking and growing community partner lists. Now, of course, we've all heard of networking before. As professionals working in elder care and in the disability arena, we certainly do lots of networking. It's important to build relationships. But what we try to do with PA Link, and each region is different, the way that they handle things, but we really want to try to dig deeper. It's not that 30-second elevator speech that we've all heard about, trying to get the high points over to the people across the table from us. It's really more about getting more in depth. So if I am talking to Tammy Weber, yes, I know she's an elder law attorney, that's great. But you're also a certified elder law attorney, and you can help, with this kind of problem and that kind of problem. You can really dig a little bit deeper, and that's part of the whole idea, what I consider to be a trickle-down effect. If the partners know each other, if they have a relationship, if they fully understand what's going on, we can really serve the client better and the consumer better. So that's really the focus with the partnership development. And as we network and as we join groups, and Tammy, you and I were just talking about this before the webinar started, we grow what we call the partnership list. And this is an up-to-date, which is really hard to do in our industry, list of professionals that are working in the area. And what we do is we send these lists down to a call center in the Harrisburg area. And that way, if a consumer calls the call center with some issues, then they can have a list, an up-to-date list of individuals that are in the local community that are really able to help maybe get them started in the right direction. So that's how the community partnership list idea started.
Interesting. So is that list on a website anywhere?
It's going to be. There is a website that's going to be working. I think it prompts you with a couple questions and will kind of, for lack of better terms, spit out some choices for you and some information. So I think that's where we're at right now with the website. But as of now, anyone can call the statewide. It's a toll-free number, and I'll give you that number a couple times. It's 1-800-753-8827. And that's our statewide number. Now, the other thing that we are really focused on are community events and outreach. It's really great, we learn about unmet needs, but how do those consumers and older adults and people with disabilities and their families and their caregivers, how do they find out about what's going on and what's out there? So since I've started, just some examples of community outreach and things that we have done. There's not a lot of resources out there for somebody that's been diagnosed with early onset Alzheimer's. I'm sure you see clients come in their 50s, 60s, maybe still have children in high school, and there's not a lot of resources out there. So a couple of people approached Link and some other community partners about putting together a program for a free viewing of the movie Still Alice, which is a wonderful movie that really shows the progression of the disease through a 50-something-year-old woman.
Professor.
Yes.
Right.
Yes. And
Excellent.
her family.
Excellent book.
Excellent book. So what we were able to do was collaborate with the church and the library and the Alzheimer's Association and even a neurologist to come together. We did a free viewing of the movie, and we had a panel discussion afterwards, which was really great for people in the audience, many of whom were dealing with this problem themselves and their families, to ask questions, get some more resources. And what was really great about that particular community outreach project is that we were able to take that one step further. So everyone saw the audience, we had a great turnout, and we really understood that there was a need. So now the Alzheimer's Association got involved, the church got involved, and since then, things have progressed, and now there is a caregiver support group that's offered at the church. So that's one way we took one event, but really have it made it even more impactful in our communities and as a resource for people. Other things we do, one of the Centers for Independent Living, they have an adapted haunted house, which is a great idea. So for individuals in a wheelchair, they can have that whole idea of Halloween and what's going on.
Is it less scary, Melissa?
I don't know. It could be scary. It could be very scary. Okay. But it's a great concept, and there's nothing like that in our region. So PA Link is working with them to help bring in some more people to the event, to make it more, reach out to organizations and have our partners come and set up a table and help with decorations and things like that, so that their residents and consumers can come and enjoy the haunted house as well. I say enjoy it. I don't, you know what I mean. But
so it's not just knowledge and information. There's application that assists all of the people and their families in living a more productive life.
Absolutely.
And fun.
Absolutely. Yep.
Yeah,
yep. And
great.
It's all based on that unmet need idea too.
And I understand you also coordinated an event yesterday in Center County with respect to elder abuse.
Yeah, it's such a prevalent issue.
It is.
All across the nation, unfortunately, whether it's physical abuse of seniors or financial abuse of seniors. And I am part of the task force that's newly created up in Center County. So we brought a training with some wonderful speakers from Temple University up to the State College area. And we spent the day, unfortunately, learning about these things. And then the afternoon, we spent time with bank tellers, because a lot of times they're on the front line and they see, especially the financial abuse that's happening with their longtime customers, trying to give them some tools and techniques to really be able to identify those things and know what to do, what options are available. So yeah, exactly. Those are ideas and things that we do as community outreach, and then that really also kind of falls in with our trainings and different things as well.
Right.
Professional development. And then the other thing, speaking of the professional development and the professional trainings, we try to do a lot with educating our professionals locally. I know, Tammy, this is something near and dear to your heart as well. I know here at the firm, you guys have done the professional update for 20 years.
21 years.
Oh, 21 years. I was off by a year. But it's the same theory and philosophy. It used to be, even human service agencies would pack up a van load of their workers and their staff and send them to a conference in Baltimore for 3 days to learn the latest and the greatest techniques and things that are going on, or to New York, or even, somewhere even more fun than New York, I guess, maybe Hawaii or California or somewhere like that. But in this day and age, that's really not an option for most people. It's the staff time. Everyone's under a crunch. Everyone's adding more things to the schedule or in their lists, not less things. So what we try to do, very similar to with your professional updates, is we try to bring those wonderful speakers and those wonderful training ideas to the area locally. It's much easier for a facility to send their social workers, a half hour down the road to get their credits and be back after lunch versus 3 or 4 days out of the office. And although that's still great and wonderful when you can do it, it's more difficult. So we really try to come up with ideas of the new things and things that are going on and try to bring them to the area so that we can educate the professionals and hopefully have that trickle down to our consumers so they have the latest and greatest too.
The team approach and the collaborative approach, to borrow your word, Melissa,
Thank you.
gives the best service to the consumer.
Absolutely, absolutely. And I think, I've been around in this whole aging network now for quite a while and newer to the disability sides of things. But I think that mindset has changed a lot over the last 15, 20 years. It's not as secular and everyone's in their own lane doing their own thing. It takes a village. It truly takes a village with some of these seniors, especially there's so many requirements and limitations on some of the things that we can offer. But if we all work together and we all understand what's going on and we really know the value of each of us as professionals, there's really a lot of room for us to help the individual. So it takes a village to get our seniors and individuals with disabilities the best care and the best outcomes for sure. Yeah, absolutely. And so the professional trainings is something that we spend a lot of time focusing on, that we do. We're always asking for ideas of things that people see in the community that could help them. And professionals always come up with great ideas. They're really the feeders for us to come up with trainings. And then we do those almost always are no cost or as little cost as possible to those who are able to attend.
Well, thank you for that.
Sure, absolutely. Yeah, it can be a lot of work, but it's definitely well worth it. Absolutely. And then last but certainly not least, I want to touch a little bit on this idea of person-centered counseling. So person-centered counseling has been around for a while. Some people may have known it as, they used to call it options counseling. It's another one of those things we change the names and work around and morph into what we think is the best way to go. And person-centered counseling is kind of unique to PA Link in that it kind of sets us apart from other groups and organizations in what we're doing. And what I like to do when people ask me about person-centered counseling, I like to kind of break it down for them kind of like a scale or a spectrum. So a lot of times when someone really needs care or services or something, maybe they know exactly what they want or what they need, and maybe they just can't find the phone number, or they just can't find something. A lot of times the aging offices or the Centers for Independent Living will get those initial phone calls, and people will ask for specific information, and the people on the other end of the phone can give it to them. And in our industry, that's what we call INR,
right?
Information and referral. We're giving information and we're referring them somewhere else, and that's great. And then there's a little bit of room in the middle, I think. And then towards the other end of the scale, I think some people use services like you guys. I know you offer here care management services as part of what you do, where you truly have an advocate that walks you through the system. And maybe I'm putting words in your mouth, Tammy, but
no, it's fine. You do. You do need somebody. It's
right.
A non-legal service.
Correct.
Go to the care management meetings. Go help retrofit your house so it's safe for you to age in place, etc.
Exactly. Yes, and it's very hands-on. I view that as very hands-on. And then there's, as there always is, room in the middle. There's some gray area in the middle. And that is sometimes where person-centered counseling can come into play and be really helpful to a family and to a person. Person-centered counseling isn't called person-centered counseling just for fun. It's really based on the person. If I tell you, Tammy, what to do, you may or may not listen to me. But if you make your own decision and you follow through with it, the probability is you're going to be much more willing to do it. I hope that's the case. Maybe you would listen to me. I don't know. But with person-centered counseling, the idea is the person themselves is really guiding the process. And so what usually happens with person-centered counseling is the individual themselves will call and kind of talk through some needs that they have. And just by collecting the information and gathering the information, we have person-centered counselors across the state who have gone to pretty in-depth trainings. It's a full day, in-person training day so that they can kind of fact-find and point these individuals in the right direction. And if somebody has more than, say, 2 needs, maybe it's housing, they're no longer able to live in their home or their apartment anymore. Maybe they're having trouble bathing, or they can't afford their groceries anymore. Wide variety of different things can pop up. A person-centered counselor can talk with them individually, kind of come up with a game plan for them, and then have them execute the game plan themselves. So the person-centered counselor isn't doing the work. The individual themselves are doing the work. And that's also where it's very different, I'm sure, from the care management function you guys have here at the office, is it's more the individual themselves that are doing it. And then it's not like you just gave them the information and set them on their way. The counselors will talk with the individual and set up a time to follow up, to make sure they did what they were supposed to do. Maybe help give them what we call warm transfer, transfer them live on the line to somebody that might be able to help them, and really try to do a little bit more follow-up and enable that person to make their own decisions and let them feel empowered, which is really important.
So this is a phone counseling?
Most
of the
cases,
time?
it's a
Okay.
phone counseling session. Again, it can be set up just by calling our toll-free number, our statewide number, and that's a great way to get the process started. And it's also a great way for us to work with professionals too. So the people that are person-centered counselors, they really try to have some firsthand experience, know what's going on in the community, again, know what's out there, attended our networking meetings and trainings, so that they're able to really use that local professional network of people to get these people, their consumers, the care that they really need. So it's, like I said, it's evolving, especially in our area. We're doing it more and more. We've been watching the outcomes, and it's really helped to empower some of our consumers to make their own decisions and just take the first step. You know how difficult it can be for people just to take the first step and just to know that you're not alone.
And it's a buy-in. It's evidence
Absolutely.
of the buy-in, which would help. Again, if I make the decision for myself, I'm more likely to follow up.
Absolutely. Absolutely. Yep. And then just for me, I don't know if you have anything else to add, Tammy, if we're good for time, but I just wanted to, again, let everyone know about the statewide number, 1-800-753-8827. And again, the state is broken up. I'm what's considered a local lead coordinator, so I cover 9 counties with my position. And then we have regional coordinators as well who cover the Northeast, Southwest, all the places in the state. So whether you or a family member or even one of your clients or residents has an issue and maybe living in Erie or Clearfield or wherever it might be, if they reach out to the toll-free number, there's certainly a link coordinator that would be able to point them in the right direction. We get lots of different kinds of phone calls, and we do our best to navigate. And I always say I'm not necessarily going to have the solution, and I'm not necessarily going to be able to give you someone that can give you the solution for free. But they can call me, and there's no cost involved. Or they can call our toll-free number, obviously, and there's no cost involved to at least get started on the path.
Excellent resource. And if what we do with the webinars, and we'll allow some time here if anyone has any questions, we'll answer them as they're received. If not, this webinar is going to be on our YouTube channel, so you just go to paelderlaw.com and you can find it by clicking through. We also, if you're interested, have an online resource page that you can get to from our website. As Melissa noted, many people, or the families of people with disabilities, no matter what the age, are not able, for whatever reason, maybe they don't have a caregiver to spell them as they need to go out and do things. You can get a lot of information through our website, blog articles, our LinkedIn page if you're a professional. I don't see any questions coming up here today, so I thank you all for tuning in, and thank you very much, Melissa, for joining us today.
Sure, thanks for having me.